I want to thank everybody for coming in person. This is our first in-person meeting. It's so nice to be in the same room with you all. So I had sent out in the meeting packet, the agenda was included as well as the meeting minutes. And we'll just start with an agenda review. And if anybody had any questions on it. Okay, motion to accept. I don't see that we have any public present for public comment on the agenda, so we'll move on to the next piece, which is the mission review. And Chris is going to read that for us.
Okay. Mission is to offer advice to the St. Albans Police Department for the successful implementation of 21st century policing strategies and to assist the police department in following the established roadmap as amended by the City Council.
Thank you, Chris. Okay, and then the next item on the agenda is to review the meeting minutes. And I apologize because I'm realizing now with the, I believe I put on the agenda June and July, and this is obviously the August meeting minutes, who Tom so graciously did for us. Thank you, Tom.
You're welcome.
So I'd entertain a motion to accept the minutes unless there's any discussion on them.
I'll make a motion.
Thank you, Danielle.
I second.
Winnie second. Thank you. All in favor? Say aye.
Aye.
Any opposed? Same sign. Motion
I will
passes.
abstain because I was not here.
Okay, thank you. So Jamie abstained for not being present. So the next item on the agenda is an area of focus that we've been talking about for a while, which is discussion with the embedded crisis workers. And we've been blessed enough that Sam and Nick are both willing to join us today to talk a little bit about that. They've been doing this work for a while. I know the actual work's been done in this county for at least 5 years. I think Nick was one of the first people. And I'm not going to say anymore. I'm going to let him introduce himself, let Sam introduce herself, and then just let them get us an overview of what that work looks like. So I'll start with you, Nick.
I am Nick Tebbets. I started going on 6 years with the state police doing crisis work through NCSS and supporting the city at times. Sam is now doing all the city work. I'll let her run with more city stuff than VSB stuff.
Hi, I'm Sam Weber. I've been the embedded clinician for City PD since the beginning of this year.
And Nick, do you want to introduce your sidekick?
Yeah, this is my co-worker, Cooper. We do search and rescue, and we do tracking for life-saving measure for criminal work. And he's going on 3 years old and has a wonderful ear infection right now, so I will keep him in my corner and all of his ear goop on my leg. But we also do therapy work with different people as I meet them doing my job, or if they are at the barracks, we meet with them there.
Awesome. So I think one of the questions, I want to target it just towards the dog since you're just talking about him, but I had seen an article and a news story on the work that Cooper does. Could you give us an example of that just to get a feel for his role with you?
Yeah, so a lot of our work is obviously the juveniles. Kids really like working with Cooper. Also, where we've seen a huge benefit is at fatals or accidental deaths, where typically people shut down or don't want to talk to a complete stranger. Just having a dog there, they immediately open up and talk to me, and we are able to utilize him to build rapport and get people connected to services that typically might not be open to talking or accepting services at the time. So we went to, it's hard to do stories and not violate HIPAA. We went to an accidental death at a job site, and there's a very close-knit group of people that work there that absolutely did not want to talk to anybody, didn't want to talk mental health, they just wanted to leave, they didn't want any services, and I just let him out to go to the bathroom. And all three of them were surrounding my car, telling me stories about their dogs. They were open to working with me. I got 2 out of 3 connected into therapy. And it was actually the first week I had him, and it was just letting him out to the bathroom. So he's been a huge asset for that, in that regard. Not only the search and rescue, but just starting conversations. Even conversations when people are apparently highly allergic. You learn a lot about people very quickly.
So I don't know, Sam, do you want to give a little overview of how things are going and what your days look like?
Sure.
I know that it's hard to sum up, but just a little overview.
Whatever St. Albans wants to give us that day. So I am at the PD Monday through Thursday right now from 9 to 5. So I start my day actually with our NCSS crisis meeting so that I can make sure I have any important information to coordinate with or follow up on during the day. And then I spend most of my day with at least one of the officers and in the cruisers with them out on the streets and just responding to whatever calls come in. Sometimes they swap me over to break the city up into zones. So if something's happening in the zone that I'm not in at the moment, sometimes I swap vehicles to go with the officers if it seems like it's a call that I would be helpful at. And we go and find out what we can do to help. We found that that model's been super helpful compared to waiting and calling specifically for a crisis worker, because we've really found that there's a lot of calls that come in. For the most part, people who are speaking to police probably aren't having a great day. So even if it's not necessarily a mental health call, we found success even in people who have been really upset because they've seen somebody else's dog locked in a car on a hot day. So that might be something that the police have one role in, but I'm able to just make that interaction maybe a little bit more comfortable for the other people in the community who might just be upset about what's going on.
Can you guys talk about, and I'm not sure who to ask this question to, and then I'm going to step back so everybody else can ask questions, but Team 2 training. Can you just give everyone an overview so they can have a better understanding of what that is?
Yeah, so Team 2 training is a really great initiative in Vermont. Kristen Chandler is sort of the oversight of that, I believe, still. Tony Stevens, who runs our crisis team at NCSS, Chief Lamothe is part of that for the trainers, and it's really just any professional in Vermont who might overlap into the mental health field or law enforcement or both, even if they're working at a school and they might have law enforcement coming for their students, something like that. They can come to this training. I think it's usually a full 8 hours, and it's a really mixed bag of who's present. There's usually some law enforcement, there's usually some human services folk, and they have a really great curriculum of just kind of making sure that everybody kind of has an idea of what each person's role might be in responding to things. And it can be really frustrating when people are looked at as helpers and then they get there and they're like, oh, that's not my role, or that's not something I can help with. So kind of pre-paves a little bit of what you can expect from people, what it might even be like to talk to dispatch if you have to call 911. And then the conversations are very fluid and dynamic because depending on who's present can really change the way that narrative is going. Dr. Avila actually attended one recently that I was in, and that was really great too, to really get like the hospital perspective and her cultural perspective in. So there's really can change the way that goes, but it's a really great training. It's been running for, I think, 8 years?
8 to 10 years. What's unique about Team 2 training is that it's one of the only trainings that's mixes law enforcement with social services in the same room during the trainings. Most trainings are unique to law enforcement, and I can't speak for social services or mental health. I'm assuming most of their trainings are in-house as well. This blends the two, as Sam said. So the idea is you can both be in the same scenario, because a lot of those training days are scenario-based. And the idea is, what would law enforcement do if you're isolated on this call? What would social services do or mental health workers do if they're isolated on these calls? Now you have the opportunity to be both of you there. What would you do now that you have a team? And that's the idea, talk through it. And it's mandatory, as law enforcement has to go through it within a couple of years of being certified. I think it might be 18 months or 2 years, but there's a timeline with which you come out of the academy and get a little time there, then you have to partake in this training. And we're doing a big one, and we have the email today. The meeting is in October, I think it's November. We're doing a good sized training for a bunch of new officers coming out. So a bunch of new officers that haven't been through it yet. So it'll be a good training. It's a great, I just became an instructor recently for towing, but I've actually done it out of times.
Right.
20 times, so.
Awesome.
I think we might have some people at the front door down there trying to get in public-wise.
I can come out,
Okay, sure. Thank you.
Just FYI, I'm getting
Thank
the
you.
frustrated messages.
Oh, no.
All good, all good.
I appreciate that. Thank you.
You finished?
Yeah.
Okay. Well, the question that I would have, can you give us in terms of statistics, how much is more drug-related, mental health related, or emotional related?
I can give you the best statistics I have. Certainly one of the things that's happening in Vermont right now is we're trying to learn what statistics are important and how to gather them consistently and across the board for all of these different positions. For example, what Nick's responding to with VSP is sometimes very different than what I might be responding to in the city. He's never going to go to a call, most likely is not going to go to a call where there's somebody worried about a dog locked in the car. That's a St. Albans City kind of community thing. So understanding what we all need to be tracking is complicated. I went and at least just kind of pulled a snapshot of my own statistics since I've been doing the job. Part of the problem there is still I'm day shift in the middle of the week versus nights and weekends, so that really also changes what that looks like. For me, it looks like really not very many of the calls that I'm going on are directly substance abuse related. They might be if one of the examples that we come across a lot is community members are calling in about something that they're observing, and it looks like it's somebody who's having a mental health concern, and instead it's a substance-related issue. So depending on how those play out and what the safety factors are, really depends on how involved I'm going to be in that call. Frequently, I find that if they're at that level, either the legal process needs to kick in and it's not a place where I'm going to be, or we've had some pretty great success making referrals in the field to Melinda and also to the Howard Center, Christine, who does a lot of the in the field assessment, trying to get people hooked up into substance use treatment if that's what they're looking for. So that's been pretty successful, but again, part of it is how the call comes in really changes how the data looks like when we run it on the back end. One of the things I thought was really interesting is a lot of times they come in as just a general disturbance call, and then it turns out that that disturbance has some sort of component that I'm able to be helpful with.
So you really don't have no hard statistics concerning St. Albans City in terms of?
Not yet. I don't know what you might be able to pull. I mean,
that's part of the discussion. Numbers wise?
when he was just asking about statistics as far as mental health, substance abuse.
Substance abuse,
And
no.
domestic one.
Substance abuse, no. Statistics for mental health calls, and we have 104 that you've been to, but for the year, Zach might actually, I don't know if we sent it to you or the messenger, but there were some numbers on that last year. I didn't pull anything here, but I would be guessing, but I know Sam's been to, like you said, like 100 and something this year, but it's so subjective because it all depends if dispatch punched it in, it all depends if the call came in as mental health. So I've never based any of this on statistics, so it's really hard. I don't really care about. For this purpose, I'm just looking to help people with this program, and that's how I've been selling it since it started. I know it benefits us, I know it benefits the community. I know there's a huge use for it. We do keep track of it, but it's so subjective on when it's deemed as a mental health call. Okay. She goes to calls all day long, whether it's beneficial. Sometimes she hooks people up immediately to services. Sometimes people get benefit from her being there or me being there at the time. Sometimes they may go to the back door to get services, but if it helps, it helps.
And I think also along the lines of the data, it's what they give us for information. So around like substance use and that sort of stuff. So I've had people that on paper are like, I absolutely don't use substances or anything like that. And then I explain Melinda, and I'm like, oh yeah, I would chat with her. So data-wise, that's a negative for my data, but a positive for connecting to resources. So it's, that's where the data is hard because we have to take the information that we're given, and a lot of times people are honest with us, but sometimes, you know, they aren't, but they're still open to services, so.
We have data that shows intoxication and stuff, but we don't have anything that shows, like I'm a substance abuser, I use substances and this is why you're here. We don't have anything that keeps track of that.
No. No, I wasn't looking for that specific. In my experience, and I'm no social worker or whatever, but dealing as a community person, what I've dealt with is that domestic violence, emotional distress, drugs, as well as, how do you say it, addictions of different sorts. And there's this hesitation of getting you guys involved because they don't want to get that information out there. So that is why I asked that hard question in terms of what statistics you have, because in order for you to get the statistics, in order to approach NCSS to have more people there, we got to show that need. And so I was at a meeting earlier today and I just happened to mention St. Albans, and they were like, oh, St. Albans has that problem is Vinitsky, and I was like, really? So that's why I asked that, because they couldn't find any statistics, and I was like, oh yeah, I'm sure they have statistics.
Well, and one of the things I was talking about with the chief prior to coming here was there's so much anecdotal information, it really is hard to capture. I can give you so many different examples of times where we have responded to a domestic violence call. The individuals have been reluctant to share any information, and usually what I found to be really successful is I'm just like, hey, can I just text you my number real quick? You can reach out to me another time. And then next thing you know, I have, the person who we would have identified as the victim suddenly reaching out when they have private time because we no longer have the parties like in the middle of their situation. So a lot of those things happen as we develop rapport with community members, and figuring out how to track it to give those tangible numbers is something that we're just trying to standardize across the state.
But I will say, Wayne, that we have a program with the police. It's a high lethality risk assessment program, and we do have stats on that. So if that person falls into that category, we're called, and we keep information on that. We report that to our funder. So
we can also track the number of referrals that we get from the embedded clinicians. So that is one data point in which we'll be able to track the impact of the physicians as well.
You actually brought up a really great point, and we definitely collect a lot of data, but like your exact scenario is perfect to describe why it's hard to collect the data. So we respond to that domestic violence call, right? And we work with those people, and like Sam's saying, we build rapport. The only data point that's being collected is the domestic violence, but then we work with that person independently that's not tied to the call. And now we're helping them with substance abuse, we're helping them with housing, we're helping them with mental health services, all those things, and those are all separate data points that wouldn't show on the same person. So that's a big part of the success of this program, is because we're in the field, we meet with people at the domestic violence, and then we get to help them through all the other steps. And your point is spot on, because before this model, at a domestic violence call, they would give out the mental health phone number, they would give out substance abuse phone numbers, all those phone numbers, and even if we reach out to them, the success rate of them wanting services is like 0. Even with me in my night shift. They're like, oh yeah, I'd love to talk to Nick in the morning. And then I call them, they're like, yeah, I'm all set. But then I can go that afternoon to the same call, and I talk to the person, and then all of a sudden they're like, oh, I'm open to services. And then I can stay connected with them. And that's a long-winded way of saying we're collecting the data, but it doesn't highlight all the data points per call, because it's spread out over time also.
And that is a challenge. Our program just doesn't allow that data. It's not set up. Ours is a police program. We're tied to the state program, and it's very selective on what we can collect. So it would rely on everybody else's, an agency's data. That's going to be the problem. And up to this point, I shouldn't say at this point, but up to now, the relationship we've had with NCSS has always been, we know it's working. We know it's working well. And it's through the stories and through the success and through the lack of people going to the ER for help because they're getting it directly and getting the services. That's how we judge our success and gauge our success. With actually so hard numbers, that's what's going to be very difficult, especially on our program end, on our state program end. It's just very difficult to do. And like both of them pointed out, it's very hard for people to be forthcoming with us when we're there for our purposes. That's why we shift from our purposes to their purposes at some point in the transaction.
One of the things that, when we're talking about tracking referrals, one of the things that gets a little bit complicated, and again, it might be different for Nick, who's responding to a larger area, but some of the data I do have tells me that about a third of my contacts are actually with established MCSS clients, or they're already working with Pathways or some other community agency, and so that's not going to be counted as a new referral, but a lot of times there's a lot of treatment team coordination where they may not have been able to reach out to their treatment team and be like, hey, this is what's going on, I've had a really bad day, whatever happened. But if I say, oh, you're working with them, is it okay if I reach out? And they're like, I'd love that. So there's a continuity of care that happens that is definitely keeping things from escalating, or for some people maybe falling through the cracks, or if they're struggling with issues that substance abuse related or something. If I can get Melinda or Christine to just come right out there in the moment, and then they can keep working with them. You know, those things don't look like new referrals, but they're definitely places where we're making sure people are getting what they need.
And I'd say that's probably the constant that we're seeing is when we're involved with people, they've been connected in the past, but that connection has lapsed and that's why they're struggling. So very rarely am I doing a brand new referral, but it's more reconnection. And that's, I'd say, almost every call is probably that.
Yeah, that's something that makes me think of when I look at, because I can actually data sort the referrals I get, and SIPD is one of my largest referral partners out of all of the community partners. And if it's a call that I'm connected with the person really quickly after the interaction, or sometimes at the same time, the follow-through is amazing, and when it's calling the next day, it's just like Nick said, and historically I had the flexibility to jump out and be on site more often, so the success rate was higher. But what it does help with is there might be somebody that I might be kind of following for 2 to 3 years, and then when they pop back up, that connection is already there. I had a call from a different law enforcement agency 3 weeks ago, and when they said my name to the person, they started crying, whereas right before they were tight-lipped, wanted nothing to do with them. When my name was said, she remembered, and then I went right there. So that's like, it is really the relationship more than anything, like that quick contact, which is why we know these positions are so vital.
And I think the relationships is, you know, over 5-6 years, and Sam's relationships in the city, we have people calling that are friends of people that are struggling, that are calling. We run into people that have relationships with law enforcement, and they'll call the law enforcement and say, hey, can you send Nick out here? My friend's struggling. So we're getting referrals by independent community members that we have supported in the past that we never would have gotten before this sort of program was out there, because we were never out there. We were always that phone call the next day where people are like, I'm feeling a lot better. And, you know, nobody helps support walk them through that, so.
So is there any evidence, and I know we've talked before, Chief, about having to be careful about, you know, not having you like go in first and be like, hello, and hope that it works out, but is there any indication for either one of you, but I guess maybe more so for our purposes, city, that when you're involved in those, we see a reduction in like the use of force and different things in that, and is that a data point that we could measure just to show the effectiveness of the program without getting too complicated about why you're there?
I don't know what the use of force data looks like from the PD's end, but, and again, this is the problem, is I could give you stories all day long, and it could even just be as simple as they see somebody in a uniform, they absolutely escalate, they're shutting doors and faces, and then even the officers are like, I have Sam here, and nobody even knows who Sam is, and then they're like, okay, well, I'll talk to her. So like, we know we're avoiding those more stressful situations that might not end the way that we want them to do, but again, we can't prove that negative, that we managed to avoid a use of force there. I don't know.
I would say, Sam, I've been asked that question so many times in the legislature, like, can you give us a number of how many percentage, how many times you've reduced or you use of force? There's no way to say that. I can say exactly what Sarah and Nick's been through, that you can see somebody's demeanor change when they see us versus when they now direct them towards Nick or Sam. I can't say definitively,
Yeah.
100% that reduced the use of force, but I can tell you the demeanor change, and that's how I explain it. We went from a very hostile, abrasive situation to a less hostile and abrasive situation, and things ended peacefully. Would have they have otherwise? I don't know. I suggest they would have, but I can't say that for sure. I can't ask the person, hey, what are we gonna do? Because their answer is always going to be, I wasn't gonna do anything.
Yeah.
But I can say that my experience from all the time I've done this without this program, and I've said, this is the best program I've seen in my 23 years now. So I think that does reduce it. I can never put a number to it.
Yeah.
It's just impossible.
And I think that's kind of, I've also been asked that question with Mo probably 1,000 times, but I think the key point to getting the data is we can't do predictive and subjective data, because when we submit data, we want it to be empirical, can't be challenged. This is not our thoughts or our ideas, this is the truth that nobody can argue, and that's one that we would love to say that we're amazing and we walk in and nobody ever.
Yeah.
The other reality is that there are times that use of force is needed and there's a law being broken, and whether we're there or not.
Sure.
You know, the person that runs at me with a knife, I hope there's somebody there that is gonna be able to do more than me, like, I don't think that's a good idea right now.
Yeah.
So.
I just wonder, could you track the times that you didn't have to use force? I mean, it's the age-old question of how you measure prevention. And, part of our programming is that we run a therapeutic school, and our goal is to not use restraint. And so instead of focusing on how many kids we didn't, you just have to look at it from a different perspective of these are the numbers in which there was not excessive force needed, and your role is a contribution to that.
So I don't think that would be possible because of the scenarios that have already, the law has already been broken, they're already escalated, they're already, we don't always have the opportunity, even if we respond, to engage. I show up and somebody's stabbing themselves and runs at us with a knife. Those events where they're crashing into people and trying to run over people and, all those data points, we can't just say that every call we go to is positive or negative, because we might not even have the opportunity to affect the outcome.
Right.
So I think we'd have extremely skewed data saying the 3 speeding tickets that I assisted with were positive. You know what I mean? You aren't collecting, you're getting apples and oranges and tomatoes all in one basket.
There are some things set in motion, whether we get there or not, whether from the second you get there, it's going to go one way so quickly that you get, like you said, you can't reject no matter who's there. It's already set, it's already happening. But that's a hard one to do too, because I can just refer to last year's numbers. We do 12,000 cases last year, 12,000 incidents, and I think we had 31 use of force or something. So I mean, the numbers are so low, so I don't know where you're going to get much different this year. Other than the case numbers are down because we don't have the town to get that. So I don't know.
I mean, it seems like it might be, it might take some sort of big picture looking at data, but, so we might, understanding that the town isn't involved anymore, that definitely makes it tricky, but my initial thought was could you look at total case numbers for a year where there were no embedded crisis workers, total case numbers versus use of force incidents, then look at a year where you did have embedded crisis workers, total case numbers versus use of force incidents, and is it the most ironclad piece of data? No, but you do have that one variable that's changed.
Right.
And then
It may be useful. I don't know.
And I think
it's difficult. We have another element that came in this year that changed everything, which is COVID, and a whole different, we have a whole different population living in our town that we respond to now. Some 5 times a day.
On my way in here.
Literally, we just walked by, I was holding the door.
Yep.
5 times a day, we're dealing with a couple individuals that have mental health issues, and they're living here now. They're not living here, they're here now. That alone increases the possibility. It's just the numbers are very difficult.
I really, really like your idea.
I do too. But there's so many.
And in theory, it sounds like it could definitely work, but there's each year you're gonna have so many different variables, like political climate, the homeless population right now because the housing issue is
massive.
all those things are gonna skew your data because you're looking at 2 data points. but there's 47 data points that affect those 2 data points. And I think, you know, any given year, if you just had somebody that sat in an office all day and never left, and you just pulled those data points, it would say, this year they did amazing, this year they did horrible, because there's just so many. If we have 240 homeless people here that are struggling this year, but next year we don't, that's gonna hugely affect our numbers.
Yeah.
Yeah, definitely tricky, but I wonder if, you know, there are some avenues to look at data, specifically by people who do that, which I do not. I'm just aware of them.
I think part of the problem for that is we're only able to do that retroactively right now. And so that's the thing is like we all need to learn what data is important to collect, how to collect it. Right now, Nick and I are collecting it active in the field. So I've done an interaction with somebody and I'm literally sitting there putting my data. So that captures the information for that call right now, but it doesn't capture any of that future contact that I have with that person that's like a fallout of that. So there's those pieces, but also right now we could only go back and pull those numbers. And this is the first time, this is the first year that City PD has had somebody embedded the way that I've done it. Right. The previous worker, that's what it was, is if they felt like it was a mental health call, they've already arrived on scene, they've already determined that it's safe, then they would call that person in. So even just the way that the program is running is really different. So as it evolves, it's hard to have consistent information.
So that's another question that I have is, I understand, Chief Mott, the police end of the collection is somewhat limited by your programming.
Yeah, a little bit.
But is there a mechanism, Sam, however you're tracking your data, are you linking, like say I went to you went to a call and at the time the person said no thanks, but in some sort of the story you told, you said a week or so or a few days down the road you got, you know, housing services, mental health services, substance abuse services. Are you linking that back to that initial contact?
Not right now.
Because I think that might be really
Absolutely. And here's the problem from the NCSS side as far as tracking goes. We're only tracking the things that I'm able to bill for. And 75% of it is not stuff, they're not active NCSS clients that already have a consent to treat on file that says it's okay for us to bill your Medicaid or something like that. So in those cases, NCSS is gathering information, which is why I can tell you more about, like, I know that 30% of my contacts are with active NCSS clients because I can look at that pretty easily. And then I can go and then make the links of I followed up with the treatment team or whatever the case may be, but it's not a new referral or something like that. It's that other 75% that's kind of a gray area. So we have been talking about different ways to track that. There's just so many initiatives that are on board right now that, you know, if I change the format that was given to me to track our outcomes right now in the middle of a random year versus like, you know, a fiscal year or a calendar year, and then 6 months from now VSP has these other positions or whatever it is, and then they're tracking it differently or we readjust it again, we keep resetting the clock on what the information looks like. So right now NCSS has chosen to stay consistent. Like, we know we're missing a big chunk of information, but at least the information I do have, it's the same outcomes that we've been tracking for as long as we've had these programs.
There may be more direction. VSP just hired morning clocks, right? So there may be more direction coming from that director's position that affects the 10 positions across the state. And if it's something we can adopt, maybe we do that. I just had a conversation with morning clocks last week about that, and we're willing to do whatever. They come up with a great program, and they're going to, by the way, so Battlecore is the system we're currently on. There was 75% of the agencies in Vermont were on Battlecore. VSP was not. And any agency they dispatched for was not until, 2 weeks ago? VSP switched to Battlecore, they crashed the system, but they're going to get on Battlecore eventually, and everybody's be on the same system. So whatever they do, we'll be able to get on, because we're all going to have the same system for the first time in my whole career.
Wow.
Every law enforcement agency to be on the same system. So it is coming, it's just a matter of the system being able to work with everybody. They thought it was ready and it wasn't ready yet, but it's going to be coming soon. So maybe they'll come up with something. I'm assuming the whole idea of hiring a director is part of that, is to track. Because they want to show that money's going to good use. So to answer your question on stats or help with stats, I do think something better is going to come.
Yeah, so I've been on the state committee for going on 2 years, and probably 50% of our meetings is trying to figure out how we can collect accurate data.
So that may
I mean, my background is in ABA, so I'm a data dork. But that's probably the largest thing, and they want to do it uniform, not just for the state positions, but the director is going to be assisting local PDs so that we can collect all the same data for the same amount of time so we can actually pool and get information out of it. So that is probably the #1 driving force in the positions, because as you guys all know, without the data, we can't grow. And
So if we just slow that down just a little bit, we may have something built for us.
When I was thinking about listening to your suggestion about what data maybe we could track and looking at the bigger picture, I was thinking, what could we do differently? And one of the things that came to mind was how many times I've watched individuals slam doors in cops' faces, and then when they see my face instead, they're like, I'll at least like hear her out. Like maybe they're not fully on board, but again, that would become like a subjective data point. It's me saying they were more receptive to me. That's like a judgment call.
And
So there's a lot of those little details of really wanting to make sure we have objective data that is telling the truth and the full story.
And there is a flip side of that too, because I have a lot of clients that would only talk to me because of the relationship with law enforcement. So it's like, how do we not collect bias information of like, they want to talk to law enforcement, but they talk to me, and then on the other side, they want to talk to me until law enforcement explain my position and what I did, and use that report, so.
Well, it'll be interesting to see if the, everybody being on the same system creates, but also maybe just community-wide data, right? Like thinking through, if you're in the field, did that person not come to the ED and take up our resources? And then so on and so forth. Did we avoid an inpatient admission or a border situation? So it feels like, the community collaborative or something.
That was my main goal originally in NCSS, was to reduce that load.
Yeah.
And we do track that data point with hospital diversions. The hard part is that is also subjective, because we also meet with people that, they've cut themselves and they need to go to the hospital.
Yeah.
And so that's not a hospital diversion, but then there's other people, so it's like.
How to
But
track
we
just the
do-
inappropriate one.
Right. We do, as it turns out in healthcare, because it's
And you have to let go of the subjective piece. I mean, mental health is subjective. So
Absolutely.
it's like, I think I don't want you to feel like the pressure to have such accurate data. Like we're trying to tell a story of like how important your positions are, because, a lot of people in the community would rather interact with you than law enforcement in some circumstances. And so like let go of some of that.
So we do collect that data.
Yeah.
It's just hard when we present that data, because everybody comes down and says,
Absolutely.
and so then
And-
it invalidates it in the meetings, so.
And sticking with the emergency department example, there are lots of times where the hospital or the emergency room is the only option. This individual has to get there. But one of the things that I can anecdotally say is going so much better is I'm there. I can ride in the ambulance with them if they want me to, so they're not alone. I am there to hand them off to triage or the nurses or whatever the team is that looks like. I'm there to help them pull their med list together if that's what they need to do. And it's just a softer transition, so that going to the ED doesn't necessarily need to be so scary, or, it might be coordinating with the nursing station so that they don't have to sit in the waiting room for an hour and the next thing you know, they leave without getting the treatment that they need. I can directly coordinate those things. So it's just as we're seeing where this is evolving to and where I am beneficial, then backtracking to figure out how do we track that.
Do you ask after you've worked with the individual, did you find this experience beneficial? Like even a simple like asking that question at the end of your encounter and like tallying it, you at least have some sort of, you can't, that's speaking to, that's client experience and showing that someone has benefited from that.
Absolutely. We try. That's not always an appropriate thing to do in the moment, so I do try. One of the things, because I've really become dependent on this, like let me just text you real quick, and all I ever say is hi, it's Sam. But that way I kind of know if something's coming back, that's somebody I've already talked to, and they know who I am without identifying, oh, this is the police or something like that, where maybe somebody sees that in their phone and gets angry. So when those things are happening, one of the things that's been really great is I've been able to, in a de-identified way, screenshot and send to Mo or send to Tony, here's all of these accolades that are coming in from these direct experiences of this person saying, thank you so much, I didn't know what to do. You know, that could have been really different, whatever the case may be, and we've got a lot of those. So it, again, doesn't become trackable per se in a standardized way, but we are trying to intentionally collect that information where people are telling us that it's helpful.
Where those come from is from the big scenes typically, more so like the suicides or the accidental deaths where you show up and there's a mass of people around this incident. In some way, for the extended family, the family reaches out. Typically, I get those calls the day after, 3 days after, 5 days after, and they appreciate the fact that one of them showed up at the time. And because that's not normal. That normally, you show up and it's just the emergency responder that shows up and that's it. But we've gotten a lot of response from that.
I think another, benefit or data to collect is, I know you make referrals, I'm sure, for follow-up and that sort of thing, but we don't always know. I mean, people don't always follow up and make those calls. But, if you were to follow up with an organization like Voices, if it's a domestic violence call, we would like to know that, so that if that person wants our help or, us to call them, we can make that connection. So therefore, they're making connections with community resources, and that's valuable information.
Absolutely, yeah.
So it's, we don't cold call people, but if we have the permission to call them and reach out to them, we can do that. We can offer housing. We can offer all those things. So that's not taking up your time, potentially.
We make a lot of referrals.
Now, I know a lot of them don't, follow through. They're not going to call, somebody they don't know.
So
but we can reach out to.
What I've been doing with Voices specifically has been sitting silently with them while they're reaching out. So you're right, that's definitely something we could be tracking better than what we're doing right now, because that's pretty easy to be like, I did this. This is how I supported this person.
Yeah, we track referrals, but we just don't know where they go.
Right.
Which would be helpful to know.
For sure.
So, on kind of a change of gears, you mentioned that you were riding around with officers and sometimes getting handed off. Do you find that there are, do you think that that dispatch is kind of mostly getting, and I'm not saying like boo dispatch or anything, but do you find that dispatch is mostly appropriately allocating you, or do you think that there could be, there could be training they could receive to, as we said, mental health stuff can be very subjective, but my guess would be that we could all get better at identifying those things and knowing how to allocate the embedded crisis workers as a resource. Do you think there's improvement there, or how does that feel, I guess, is my question.
It feels good now. There was definitely a learning curve at first, just kind of getting up off the ground at the beginning of the year, and their discretion in that and knowing where they're expected to do that versus where we let the officers make that determination. It happens kind of on the fly a lot. Like, it could be that an officer in a zone that I'm not with at the time responds to something, didn't come in as something necessarily that I would be dispatched to, and then over my radio number, my officer number is 502, it'd be like, who has 502? Bring her here. So they're pretty good about also calling for it in the moment, and then I just kind of show up. But dispatch has definitely started being able to skip off police officers in some regards. So again, it's a smaller community, so we know a lot of people. It's a lot of people that we interact with frequently. So there's absolutely times where the calls that come in where somebody's in distress is somebody that I already know from NCSS. There isn't a real safety issue, and now they can just dispatch me directly via either phone or in person. So that is starting to happen more consistently.
The benefit Sam has too is we're such a small geographic area that she can get from point A to point B or back in a hurry. Right. Makes it a little more challenged in that aspect.
Do you ever, or I guess this is more of a question of the nature of the position, are you ever asked to follow up with calls for which you were not present, like during when you're not there, or?
Yeah, so there is no set way on how they ask me to do that, because I'll take the information any way they want to give it to me. So sometimes that is, even if it's after hours, they might be texting me because they know I worked with somebody earlier, and if I happen to catch it, then I know that I need to. I get emails from people being like, hey, this is what happened. I get copied on the shift report, so if there's something that they want to bring special attention to from the shift report, or if I even see names that stand out to me that maybe it wouldn't to the officer. And then we do have internally a referral form, so if I'm out for an extended period of time and there's not an immediate urgency, there's literally a paper form that they can fill out that's a referral to me. So I'll take those referrals any way they want to give them to me, and there's a couple of different avenues that we can do that.
And I think just to tie to that also, so they, say it's a nighttime call and neither of us work nights, they might work with the on-call crisis worker, then they'll update Sam, and Sam now has the information from the call, the information from the crisis worker, works with the crisis worker, and then can follow up with the person. So it's, we're getting a lot of information and support so that person, if it's a traumatic event, doesn't have to relive that event, because not only do we have the law enforcement report, we have the crisis report, and a lot of times I find that it's more of a warm handoff, us calling when they've already had contact with 3 people saying, Sam will follow up with you, versus just, hey, why don't you reach out to me? You guys have great
That's a
questions.
success in itself.
Better than some of the legislative questions.
Do you think, sorry, I'm gonna keep going.
I know, you've been waiting for a while.
Do you, just in terms of like, you know, do you find that there's a noticeable split? Is it like, hey, there's way more stuff that I'm needed for in the middle of the night versus during the day, or is it pretty even, or?
I think it depends. So at least in St. Albans, my anecdotal experience is these guys have been handling this one way or another, with or without me, for a very long time. So it is kind of a subjective thing about whether or not I would be helpful. One of the things that I, again, subjectively am measuring my own success in this role right now in is how often when I'm not in the office, I am getting officers who are like, where are you? Why are you not working? Who cares that it's Saturday? I'm like, I care that it's Saturday, you know, but, you know, and they are seeking that out even after hours. So it's no longer that they're compelled to work with me and they're like, yeah, well, Sam's here, or take it or leave it. It's literally, we're looking for Sam when she's not here. So, you know, could I be more effective maybe when they're responding to Canaan Street on a Friday night? Maybe. Maybe not. But we're really finding that there is a lot during the day that this has been evolving into, even if it's, you know, and I know that the schools can be sort of a sensitive subject, but it's really nice when they're concerned about students and they don't feel like they can handle it in-house all of the time, that I can go into the school and then the student isn't being pulled out of the school, their whole school day isn't necessarily being disrupted. We can do it with a little bit more dignity and thoughtfulness. So, you know, those things are mostly happening during the day. So the juvenile piece has definitely been one of the things that has developed a little bit more, where it is more daytime.
I can say unequivocally on my end, we could have 2 during day shift and 2 during night shift.
Yeah.
The challenge with night shift is obviously you might have a higher level of impairment, and as far as being able to screen if somebody's intoxicated, we can't do that, but that doesn't mean that we can't work with, support, de-escalate, all those things. And you know, all those incidental calls that we go to, you know, there's more, tends to be more early morning fatal car accidents, or late night accidents, those sort of things where we work on scene, get people connected. We absolutely could be utilized there, and that's not something that on-call crisis is able to do. So on-call crisis covers the whole county. They can't just go to a fatal car accident and stay there, not. So those sort of things would be huge for any community.
Yeah, that's what, you know, even kind of as you said, you know, during the off hours, having people, you know, speak with the on-call crisis worker or whoever else, and then eventually get referred to you. What struck me is kind of like, gosh, if we just had Colonial and have more availability, how much smoother that might be. And
Well, and it's a lot, right? So for anybody who's going through any kind of crisis that they need any of us as service providers in, like Nick was saying, having to tell the story over and over and over again is so detrimental. Like at some point it's like, never mind, I will sink or swim on my own. So for sure, those in the moment things, I think for me, and I could be wrong, but for me, it's like the Friday day and the Saturday day and the Sunday day where I'm not there that I feel bad, because it's less about what happens maybe at night in the city for me, but more about just the people are living on the weekends. You know, a lot of times they're going to work up during the week, so on the weekends is when they're struggling with their kids or their spouse or whatever the case may be. Free time alone can be a lot for some people to say.
And definitely the in-person is, you know, the model that we're even talking to crisis over the phone. They know them and there might be a little bit of rapport, but if crisis was able to be there in person while they're in crisis, the world of just, you know, whether it's voices or any of the services that we help people connect to, you just don't see that. We see more repeated crisis calls from a person versus if we have one-time interaction, they'll follow up with us, but I don't work with people independently. Like I connect them with therapy, voices, state, all those services, and then, you know, they'll reach out and update me, but it's not the repeated calls because they aren't just talking to somebody over the phone. They're building that connection, so when they're struggling, they know who to go to.
Right.
I apologize, I have to go. Nick and Sam, thank you so much for presenting to us.
Thank you, Danielle. Yeah, and I'm looking at the time, and it's heartbreaking because I don't want to shut this down. This is like such amazing conversation, and I also want to be mindful of everybody's time. So before, I want to thank both of you, but is there any other unasked questions that you guys want to ask? Because I want to make sure everybody had a chance to get their questions.
Yeah, the question, listening to that dialogue, it was very good. But at the end of each interaction, do you guys do a personal survey to this person, just asking them simple questions like, do you think it was effective? Would you recommend it to a friend? You know, everywhere you get a survey after these days, so that you could at least get a gauge as to how effective it is, individualized effectiveness.
We don't, at this point in a consistent way, part of that, like Chief Lamont was pointing out, is for us currently, one of the things that we're facing is a lot of transient population. We don't really have a great way necessarily to make sure that we can do those follow-ups. I think that they are attempting, there's some surveys that have been going out in the St. Albans community recently, where they are trying to get some of that, but there isn't a system in place for these roles specifically.
And so also when we first started in the state police, we were obviously trying to do data collection and that sort of stuff. And I think it was like a very short time, we tried to do that in our first interactions or our second, because once we get people connected, we don't necessarily have a lot of follow-up. And it really affected the rapport, because then they felt like a client and that we weren't there for them. Like it was like almost like we were asking for their insurance information by saying, "Hey, how awesome was I? Did I change your life? Just fill this out. No pressure. I'm gonna stand right here. Well, you tell me how amazing I was." And that kind of, we kind of stopped doing that because we're realistically dealing with people on the worst day of their lives. So when we're working with them, we're there for them, we're there to support them, and anything that we do that makes them feel like that's not why we're there, immediately just ruins the rapport, the trust. There were times that they wanted us to get insurance information. It was like, I just worked with this person at a fatal car accident, I'm not gonna ask them for their insurance. So that's the other hard part is, in theory, that would be amazing. I would love to do that because it would be really great data and it'd be, but we don't want to risk the relationships that we have with people that are either going to be volatile in the future or high risk to get that.
Right. I think the two words, the scenarios I would give you that would hinder us, like if we just had somebody that was on the parking garage, suicidal, and we got them down successfully, then you ask them that question, they think, wait a minute, you did all this to make sure you did your job. And so next time they might not cooperate, or worse yet, we do something, we get somebody de-escalated, we still handcuff them and arrest them and lodge them, then you ask them, they're like, again, you did all this just so you're still arresting me. So I think that it would hinder us next time, and it would go against everything we're trying to do with this in regards to we just want it to a good outcome.
And that's where.
And I get your point, and I think it's great, but I think that we would hurt our relationship in the future with people that we want them to have that relationship next time. We're gonna deal with these people again, likely. It's a small community. And I want them to have a good response the first time and a better response the second time. And I don't want anything to hinder that.
But that's where if we could take, those people that call in and those stories and extract data from that, I think that'd be beneficial, but there's just no position created to take all of our phone calls and we get emails weekly and phone calls about it, but we can't, or we don't have anybody that puts that into data.
Okay. Thank you both so much. I wish we had hours left because it's such a great conversation.
I know.
Yeah, we have all these stories we can get to tell you.
I just one more question
Yeah.
on that same note. I think you probably get feelings after you're in a situation and things calm down and so forth that it was successful in the moment. I think there's value to keeping track of that. You're not asking the person, was I helpful? But you get the sense that you were helpful because the situation changed, they've calmed down. So I think that's, even though it's coming from our perspective, I think it's still valuable information. Say, yes, at the end, the person was very heightened and suicidal in the beginning, and now, they have a plan or whatever it is. I think that's still valuable information to gather.
I think it's helpful. You just have a good case, and you've had, because you've done this longer, several good cases, but would you share one case just to give an idea of what some of the things you deal with real quick? Because I think it's valuable for you to hear some of the stuff that is successful.
Are you talking
Yeah.
about the parking garage?
Whatever you want.
I'm so sorry, I really want to hear. I had a hard stop at 6. I didn't know we were going over, and I
So we
have
have
to go. And I know I have 2 agenda items on there, so I'm very interested. It's been a great conversation, but I can't stay, so table them till.
Yes, I apologize too. I should have been doing a better job looking at the time.
You're done, and I ask one more question.
So we have someone for the public, so we might as well open for the public.
I'm so sorry,
No,
everybody.
don't be sorry.
Thank you.
I'm gonna let you guys decide, do we want to let the stories come out, or do we want to save them?
No, it was just a comment I had, that I don't, how, we kind of do that at Voices. We're on a crisis call, and it's inappropriate to say, well, was I helpful? At the end or whatever. But sometimes they say, well, I feel better, or thank you, or calm down, and we record that. That's part of our outcome.
Definitely have countless stories of people that are like, I definitely would kill myself if I didn't talk to you.
Exactly.
I plan to kill myself, I plan to kill this person, those, unfortunately, we hear those quite a bit.
Right.
But yeah, I don't want to keep you guys, but
No, but I think there could be a way to capture that.
I agree, absolutely. And I
Maybe kind of on a cuff, right? Without us.
Yeah, we just have a quick check mark, a couple outcomes that you can just sense when you're talking to somebody.
I would love to see that, if you don't mind sharing that. Maybe we can connect, because I would like to just kind of, again, it helps me to have some consistency even among community partners.
Yeah, because
of how we're doing
it's,
that.
when you're dealing with people in crisis, it's not appropriate to even ask them a million questions, so, but we just kind of,
and
see how they, respond.
I do have to say, I'm really impressed that this is the first meeting I've ever been to where the first question was not, why didn't you guys just go law enforcement?
Can you repeat
I
that?
didn't hear that.
We often get asked, why don't you just go instead of law enforcement?
Oh, okay.
And I think, there's, we have endless stories as to why that is not the case. And I don't know if you guys have time for story time or if you all want to get on.
I'm gonna poll you all, are you comfortable with the meeting running a little bit over to hear them?
And if you don't, it's
Where
not,
can you
I'm not
come
gonna make
Or,
I'm certainly happy to come back.
But
I can definitely make
I think
a,
that Isabel can do it too.
I do too, and I know it was something we were
Absolutely.
hoping to get to today too, so, I want to let you, board, make a decision, if you would like us to go ahead and table and invite Nick and Sam back if they're willing to continue this.
Yeah, I make a motion to invite them back.
Yeah.
Thank you.
Yeah.
Second by John, thank you. All in favor? Say aye. Any opposed, same sign? Okay, so we'll make this, and definitely an agenda item for our next, hopefully the next meeting if it works for you guys scheduling wise, because I do think, I know that when we spoke ahead of time too, some stories would be really helpful to paint a picture. So we will go ahead and add you to a future agenda, and I can't thank you enough for coming and for bringing Cooper. I was really excited to see Cooper today. He's a good boy. Okay, so thank you guys so much.
Yes, thank you.
Thank you guys for the great questions.
Yeah, absolutely. I'm sure we're gonna have more too. So,
Real quickly, Nick and Sam, I'm Zach. I was curious if y'all could mind dropping me a business card or something if I had some questions for you on the outside, if that would be permissible.
mine are currently at the PD. I do have them, but can I just scribble down contact information for you? Is that okay?
or if you're comfortable with me emailing Zach, then I could send him both of your contact info. Is that
easier?
I'll email you
You
both.
have everything.
I do, I have both of it.
Yeah.
I really appreciate that.
Perfect.
And you give Cooper's Instagram, whatever you want.
He does.
Oh, that's funny.
Thank you all for your time. Sorry to take
Have a
up
good
so much.
night.
Good night.
Thank you. Thank you.
Thank you so much.
Absolutely.
We'll see you guys soon.
We all, I was gonna say have a good weekend, but,
Oh my God.
After today, I think, I was wishing it was a Friday.
It was a long Monday,
It was
yeah.
a long day today.
Oh wait, today's Tuesday, oh
Yeah.
my word. Okay, so the next piece was data, and I apologize to Jamie again, I didn't realize she had that hard stop. So we'll absolutely be putting that on the agenda for the next meeting, the items that she was gonna be touching on. The only other item that I had was just the training update, because we had talked about that in the last meeting. And so I did move forward with connecting with Nikki Fuller. And we are exploring what those options would look like, because while we gave her an idea of the kind of training we're looking for, she wants to make sure that if and when we do it, we are doing it in a way that's most effective to know how to utilize it. So her thought and suggestion was to do like a community listening project of some sort. So I'm gonna be reconnecting with her on that, as well as connecting with the city to see what that would look like, because that would include possibly more need for funding. But there's also an option that if she could better explain the structure of it, that we could potentially find people within our community itself just to do the community listening. So it may not necessarily have to be something that's being hired out for. So there's more to come on that, stay tuned. And yeah, she's phenomenal. So anybody who has an opportunity to do any of her trainings across the state. And then other than again, one more item that we had with Jamie, which we'll table and put in the next agenda. That would bring us to the public comment part. And this is the public comment part where we have our chief present, and I'm looking at Zach, who's like one of my favorite humans, and would you like to?
Yeah. First, I just want to say that I don't know what the circumstances were bringing Nick and Sam here, but I think just from what I did hear, I think it's really great that they are present and that they are here to answer any and all questions. So, connections of any kind that made that possible, super into that. I know that I'll be following up with them later about like their connections to Barry and Montpelier and the work, the crisis worker work that's being done down there and their methods. So I'm just like really grateful to see that and to hear that. It's awesome. I guess, I would just propose, and I see an opening, it seems like there's a huge need. You mentioned the data piece just with VSP and statewide, the fractionalization of the data collection. I would love to see, and Jamie, of course, being here, but I would really love to see some sort of discussion on a community level data collection piece that would tie in things. I know that Sam mentioned, I'd love to see how you collect, patient data. I was an EMT back in college and everything, and just experiences, codifying those as much as possible is great. And I think that where we're at right now, and all the different organizations and agencies are at right now, it seems to me that it would be good to chat more deeply or further on that topic and really get some sort of collective opinion over what kind of things the crisis workers would want, Voices would want, PD has, and others. So that would be really nice. Really, they're not here, and I'll follow up with them later again. But it just, everything that they said, it's so, I want to know what their growth plan is, because from what I was hearing and the anecdotes that they were talking about, it seems like something, and you mentioned, John, like, can we just clone you, please? Like, it seems like something that is needed, but the anecdotes even, just running through them, saying that, like, people in the community want to see them more, specifically Nick and Sam, that PD is texting these folks after hours, like saying, hey man, like input or help on this, or where are you? And then, and that's from, young members of the community, older members of the community. It just seems like this is a path forward that's wanted, and it's really just the case of how viable it is. And so, like, when I started thinking, well, how do we, like, multiply and expand a program like that? It isn't easy, because, like, I imagine the money just simply is not there. And so, when I think of things like the ARPA funding that's coming down the pipe, and while there are rules about that, like, that's millions of dollars that's going to be coming into the city. I would hope, and, I think that any kind of data would go a long way into securing some of that funding to then amplify the effects of what these workers are having. And that's a dream. I want to get there. I would love to see that happen. But just moving forward with the data piece and getting something together that everybody can kind of use seems to be like a puzzle that could use some time being solved. It breaks my heart to feeling like we're so close with these two hardworking folks, and everybody wanted them to do well. And up until now, I hadn't. It's nice to meet them, and wish them well, because I think it's important. So it breaks my heart that this is seems to be in place, and it seems to be there, and it's very tangible, but it just also seems very out of reach because of the inability to expand. And so that's my public comment. It was awesome hearing what they had to say. And man, using any sort of data to at least get past the anecdotes, which are very useful, but I feel like they obscure some things or leave questions when it comes down to funding a program like this and allocating money like this. People, I think, if they're putting dollars down, they want to see the data. So I think the data point solves a lot of different problems or issues and will allow us to improve this immeasurably. It's really nuts. It's great to hear, and it's awesome. My last thing was just, oh man, I had a dog of time getting in here for the public meeting. It was really hard. I don't want to make it seem like I'm upset, because I'm appreciative of all your time here and everything. It was just really hard getting in here. I appreciate the door in, but it was tough. So, online options, the Zoom accessibility, or even just being downstairs in the first floor conference room. I'm not sure if there's another meeting there booked or something, but I can't stress enough that, especially for public comment with chief present, it's deeply important. And thanks for taking the time to be here and listen to me. I just hope to open that up and be more accessible in the future, because it's deeply important. So those two things, the data piece seems like the center point of a lot of solutions and funding, and then the accessibility of these. Other than that, it's just so awesome to see y'all's faces too, and also to hear their story, them talk about it. I want to give them each, a couple $100,000, and just hire whoever they can find to do this work, because, you know, just with COVID and everything, you know, moving forward, I just, I've seen, just firsthand, like the mental health toll that it is really hitting people who have issues finding work or have issues managing their emotional or their substance use disorders, and all these things. So it's like, oh man, it's critical. So all this stuff, I'm just really glad to know that there are two human beings who care deeply about this, and we're willing to talk about it tonight. That's all. Yeah.
Thank you so much, Zach.
And again,
Is this the one with not supposed
Two
to?
humans and a canine doing the work.
Yeah. Well, no.
Because I could answer a couple things.
Yeah.
Do you mind if I respond?
No.
Just real quick, I agree with you on data 100%.
yeah.
The funding thing is odd. So we were the first barracks to get this in the whole state 7 years ago. It's taken 7 years to get them to fund the other 10 positions.
Yeah.
And it's a long road. And it just, when you say the right, you mentioned Nick and Sam specifically, and you're right. They're awesome at it. When we opened up the spot for Nick, he's the only one to put in.
Right.
He loves his job and has talked about it for 7 years. We opened the spot for Sam, she's the only one to put in.
Right.
They're not sought after positions either. And so that's another problem, so it has to be a really good fit. And the reason it's gonna be a good fit because they need to mesh well with the PD and be willing to leave the safety of the office and go put a vest on and go into a building where somebody has either done something really bad or there's a really gruesome scene
Right.
in some situations. So it's difficult to get, I'm not saying it's impossible, I'm saying it is a slow process, but
Yeah.
funding is number one.
Yeah.
We would love to have 6 of them, I'd love to.
Yeah.
But we are head and shoulders above most communities right now, with what we have, but it's working. Yeah, we would work better. And as far as in person versus Zoom, I appreciate this much more than Zoom on a personal level, just, but I'm open to anything.
Yeah, and I'll also just piggyback on that for the building. So Zach, you weren't the only one that
No.
had a little bit of challenges
No.
with it. So we are going to communicate as a group through email to find kind of a different, because we learned it was our first time doing in person and we had to be up here because there is in fact a meeting downstairs.
Right.
And I also was locked out of the building when I got here, calling the city manager, not really knowing what to do. So we are gonna look at that because this room also isn't technically capable of doing the hybrid. And I know for me personally, and I think most of our board has said we'd love to have both options available for
Yeah.
accessibility.
Yeah.
So that is really the ultimate goal. We would have been in person last month and there was just some, more hesitancy with COVID. So we held off for a month, but I agree. And I think what we'd like to do is try to see maybe what other locations would be available for the next meeting. So we don't have to worry about access for anyone, even if they're running late. And also maybe a location that would in fact support the hybrid model. So I love that you brought that back up because we were talking about it, a few of us that managed to get here early and get in and realizing this, okay, so we learned this isn't working out the best, so we'll figure out how to make it better. But I appreciate that you noted that.
Right.
Great. Any other comments from our board members or from Chief before we?
I appreciate seeing everybody, it was nice.
It was awesome.
This to me is, I'll do whatever you want, this to me was so much better.
I think something that Chief Lamont said is one of the outstanding questions I have for Nick and Sam is about recruitment for those positions. I'd love to talk to them about that.
They're the ones.
Say, what drew you to this? What could, if we get ourselves into the position where we can hire for more of these positions, what should we be doing?
Yeah, so I can say-
Because you're in that field and there's something about this that drew them.
Some of the new positions they have open, they're looking at the other state barracks in the state, that's what they're looking at, how are we gonna find these people? They have the funding now, how are they gonna find the right person? And they will, but it's just, you gotta be very selective, right? And,
Great strategy though, great idea,
and they've got to
great
pass
strategy.
it, they're gonna be a part of the PD now, so they've gotta go through the whole process of being vetted. So it changes as well. It's no longer just a civilian position, you've gotta get vetted through.
And I'm thinking maybe with that last comment too, because of course it'll probably be reflected in the notes, but that can be a piece that when we do bring them back, because we will have them back, that would be a good thing to ask too.
Be a little harder, not harder. Nick doesn't work for me directly. He'll be willing to come and trouble, but Sam we can get anytime.
Awesome. Great. Thank you, everyone.
I make a motion to end the meeting.
all in favor, say aye. Any opposed, same
Nice to
sign.
meet you.
Thank you so much.
Tom, good job.